Hello everyone, welcome back to the Pharmacology Masterclass by Dentospedia, one of the trusted platform for dental board examination preparation. So today topic for us is pediatric pharmacology. Now this is also one of the most important topic in pharmacology because you should know about the drugs, their contraindication, indication, side effects in regards to the pediatric patients. So let's understand in a very brief manner what it has to offer. So let's start. So, pediatric pharmacology in dentistry requires a special consideration due to the physiological, developmental, and metabolic differences between children and an adult. So, basically, both are very much different, both in physiological, developmental, and metabolic. So, we need to have the drug dosing, frequency, and everything that is very much related to the pharmacology. It has to be different, okay? And unlike adults, children vary widely in body size, organ function, drug metabolism, and making a dosing accuracy, formulation choice, and safety paramount. Okay. Now, dental practitioners must be vigilant about what? About first is the weight-based dosing. Okay. This is very much important, especially for a pedo patient. That is microgram per kg. Okay. And use of a age appropriate formulation like when to give syrup, when to give suspensions. You should know that. Minimizing the adverse effects, especially with antibiotics and analgesics. Identify contraindication and age restriction. Now, this chapter, you will be learning about the most relevant pharmacologic principles and the drug classes used in the pediatric dentistry, facing safe using, dosing tables, formulation tips, and best practices for pedo patients. Now, principles of the pediatric pharmacology. So basically, pediatric pharmacology isn't just a adult dosing in smaller amounts. Children have a unique physiologic metabolic characteristic that affect how a drug are absorbed, distributed, metabolized, and excreted. Basically, the pharmacokinetics. These age-related differences influence the drug action, dosing, accuracy, and potential risk. Understanding the pediatric pharmacokinetics and pharmacodynamics is very much essential for a dentist to prescribe safely and effective in a young patients. Now, what are the parameters that we have to see according to the pediatric concentration? Considerations, okay? Absorption, variable gastric pH is there and motility affect the bioavailability of the drug. Distribution, higher total body weight water in the pediatric patient, so water soluble drugs requires higher doses. Metabolism, immature liver enzymes, so slower clearance in the neonates because we have seen the metabolism occur in the liver. Elimination, renal clearance is also reduced in infants. Dosing based on the weight, very much important. This can be your MCQs. And also it can, second criteria is a body surface area, that is meter square, not a fixed adult dose. We have to calculate uh, according to each child that will be coming to your dental office. Always calculate dose using a current weight, not the age alone. This is very much important. This can be also very important for a clinical practice and also for your MCQs. Now, pediatric dosing rules and formulas. Precise dosing is essential in a pediatric dentistry because even a small error can cause ineffective treatment or toxicity. Children need individualized dose based on the weight or the body surface area, second criteria, due to immature organs and different drug handling. This section outlines the key pediatric doses rules like Clark rules, Young's rule, and standard weight-based dosing, and provide an example to ensure a safe prescribing of a common dental medication such as antibiotics and analgesics. So basically, these three are the rules and the formulas by which we prescribe dosage according to the weight of the child. So we use these formulas in calculating the dosage for a particular child. Now, common pediatric dosing formulas, very important, okay? Very, very important. Now, first is the Clark rule. What is the formula? Dose equals to weight in pounds divided by 150 into the adult dose of that drug. Young's rule, and it is basically the dose equals to, it is basically based on the age, it is basically based on the weight. age divided by the age plus 12 into the adult dose. Most accurate one is dose, that is milligram, equals to drug milligram per kg into the weight, that is kg. Okay, so this is also the most accurate and the easiest method, but this can also be used. Clark, this can also be your MCQs, that Clark is based on weight and Young's is based on age. This is also a potential MCQ. Okay. Now, pediatric dosing table, common dental drugs. First is the amoxicillin. That is, the dose is 20 to 40 mg per kg per day in a divided dose. Maximum daily dose is 2 to 3 gram. It is a first line antibiotics. Second is the clindamycin, 10 to 20 mg per kg per day in a 3 doses. Maximum you can give 1.8 gram, used in a penicillin allergy. So third is the analgesic paracetamol, acetaminophen, 10 to 15 mg per kg per dose every 4 to 6 hours. 60 mg per kg per day can be your maximum daily dose. Hepatotoxicity in overdose, we have learned it. Ibuprofen, 4 to 10 mg per kg per dose every 6 to 8 hours, and maximum you can give 40 mg per kg per day. Avoid in a dehydrated child because it can also cause a GI risk. This is one of the most potent risk for a ibuprofen. Metronidazole, 30 mg per kg per day in a 2 to 3 dose. Maximum you can give 1.5 gram for anaerobic infections. Okay. So these are also very important to be remembered because they are commonly used drugs. So you should know the pediatric dosing. Now this is very much important. Double check the unit. That is, it should be mg per kg, not mg per ml. Okay, this is very much important. Why? Because we will always calculate dose for a pediatric child according to the weight. That's why this unit is very important. Now, formulations for a pediatric users. Pediatric patients often faces challenge with swallowing pills and tolerating bitter tasty medications. To ensure compliance and safety, dental drugs must be prescribed in an age-appropriate formulations like syrup, suspensions, chewable, dispersible tablets. It means that according to the age of a child, you will prescribe the concerned formulation of a drug. For example, if for a very small child, it cannot swallow a pill or a tablet, then you will go with the syrup. For little bigger child, you can go with the chewable tablets or suspension or just dispersible tablets. So these are some of the things you have to see according to the age of the patient. So these formulation improves the palatability, ease of administration, and dosing precision. This section will review the most commonly used pediatric drugs forms in dentistry, highlighting their advantage, limitation, storage needs, and clinical tips for improving medication adherence in our children. Now, what are the formulation for a syrup? You can give less than 6 years of age of a child, and pros are the sweet taste, easy to swallow. What are the risk? Risk of overuse and sugar content is also there in a syrup. Suspension, you can give 6 months to 12 years of age, good for a poorly soluble drugs, shake well before using. Dispersible tablet, you can give more than 2 years of age, easy transportable, dissolve in water. Taste may affect the compliance, that the child may not like the taste. Chewable tablets, you should be slightly older than age, that is more than 4 years, that is child friendly, flavored, choking hazards if underaged, and also not having it in proper manner. And suppositories, that is decrease, that is less than 2 years, or in a vomiting case, useful if a child can swallow, limited drug availability. Suppositories is just a type of a tablet basically, which is very much dispersible. It is more dispersible than the dispersible tablets. It just, you need to have a dispersible thing, and they can have it for a child less than 2 years. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.